There are several types of Ehlers-Danlos syndrome, all of which involve hyperextensible skin, which you can see in this image. The most common type is also known for having hypermobile joints, which you can see here. Some other types you should be aware of are the classical type, which is from a defect in type 5 collagen and also comes with joint and skin symptoms, and the vascular type, which can come with easy bleeding or bruising, but also the more dangerous issue of barrier-aneurysms and organ rupture. This one is typically caused by a defect in type 3 collagen. Depending on the specific mutation, these can be either autosomal dominant or recessive. I wouldn't worry too much about the genetics or the type of collagen for Ehlers-Danlos, since there are so many different types with different etiologies. But you should be familiar enough with the symptoms that if you see hyperextensible skin in a question, and they're asking you what type of vascular pathology you should be concerned about, think of barrier-aneurysms. Okay, let's do one more question before moving on. So, a 53-year-old man presents to a clinic for the first time. He has not seen a doctor in years until a few months ago, when he presented to the emergency department with severe headaches and underwent life-saving brain surgery. On examination, you notice he has flexible joints and compliant skin, as well as an abundance of bruises all over his body. When asked, he says these things run in the family, but have never caused him any problem. What defect is most likely contributing to this patient's disease process? So again, you can go ahead and pause the video if you want to think about this. Okay, so this guy has hyperextensible skin and hypermobile joints. That narrows it down really quickly to Ehlers-Danlos syndrome, which is caused by a defect in what? Well, that's actually a tricky one because there's a lot of different types of Ehlers-Danlos caused by defects in different types of collagen. So now we need another clue from the question, which is his life-saving brain surgery. Why would someone with Ehlers-Danlos need brain surgery to save their life? A barrier-aneurysm, which you're going to see in the vascular type, and this is caused by a defect in collagen type 3. So now, another noteworthy guess would be that he had Marfan syndrome, which is a defect in fibrillin, because that also comes with hypermobile joints and barrier-aneurysms, but you wouldn't see hyperextensible skin with Marfan, and they would also probably give some more Marfan-specific signs, like tall and thin with long, thin fingers.